Hi, this is Maureen O'Hara, and I'm going to pick up where I left off in the inpatient admit register. This was that Sunday night, and this was also done on Monday morning at 9 o'clock in the morning, but I was looking for Friday just to make sure that I didn't miss anybody that had been admitted after I left on Friday evening. And also, you should check Saturday, even though currently I believe they're not admitting patients on Saturday. So, this patient actually was one of our patients who had a below knee amputation and was transferred to rehab. So that's why this one is on here, and I want to point that out to you. This patient is on 2 South, and the bed is 2070 bed 1. Patients are placed in JPI for a variety of reasons. As I stated, this particular patient we did surgery on and then got transferred to rehab. Sometimes they are placed there for isolation issues. Other times they're admitted directly to rehab and then we are consulted for some kind of amputation issue, or possibly the patient needs a revision of a previous amputation or sometimes needs to be plugged into the system. The caveat there is if the patient has had their amputation done by another surgeon, that surgeon may have already started the prosthetic process, and if that's the case, we don't want to interfere with that. So we need to find out if prosthesis has already been ordered, and if that's the case, then we will not be following those patients in clinic. Sometimes the rehab doctors seem to feel that just because the patient's had an amputation that we should follow everybody, and that is not necessarily the case. The patient may have a preference for being taken care of by the surgeon who did the actual surgery. The other thing I wanted to point out is that um, if patients for some reason start out in the 900 building, 102 or 3 North, and then are moved to other units in the JPI for isolation reasons, for example, or vice versa. They started out in a DRG bed and then get moved to a non-DRG bed. It is as if the patient was discharged from the hospital and admitted to another hospital, and that means that we will have to rewrite the orders for the pain medication and dressing changes. And if the patient is post-op, that includes physical therapy and occupational therapy. And sometimes you don't always find out that the patients have moved until someone's calling you to ask you to rewrite orders. Okay, so another way we can find out about patients is through the attending physician census. And for that, you'll click on that attending physician census item in the menu. And what comes up is this bar here, and you can type in just part of the doctor's name. So here I put in YAV for Dr. Yavari. Then you're going to click on current device, and then this will give you the current census for him. Here you can say he has quite a few ODA patients here. What's nice about the attending physician census is that it has the room number where the patient is located, the date the patient was admitted, what their admitting diagnosis is, and their type of insurance. So this patient here, even though this patient is assigned to ODA, this is probably not going to have orthopedic problems that we're going to follow. So I'm going to stop here and I'm going to pick up with my next segment.